I'm Dr. Ben Beck and I am Deputy Head of Prehospital Emergency and Trauma Research in the School of Public Health and Preventive Medicine. The Prehospital Emergency and Trauma Research Group houses a number of leading clinical registries, including the Victorian State Trauma Registry, the Victorian Orthopaedic Trauma Outcomes Registry, the BRANZ Registry of Australia and New Zealand, and the Aus-ROC Australian and New Zealand out-of-hospital cardiac arrest Epistry. Within the Prehospital Emergency and Trauma Research Group, we have the Australian Resuscitation Outcomes Consortium, or Aus-ROC. Aus-ROC is an NHMRC Centre of Research Excellence that aims to improve outcomes from out-of-hospital cardiac arrest. One of the major objectives of Aus-ROC was to establish an Australian and New Zealand epidemiological registry, or Epistry, of out-of-hospital cardiac arrest. My role within Aus-ROC is to coordinate the development of the Aus-ROC Epistry. Currently, we have a capture population of 19.3 million people, which represents 63% of the Australian population and 100% of the New Zealand population. The aim of the Aus-ROC Epistry is to identify regional variation in both the incidence and outcomes of out-of-hospital cardiac arrest, with an aim of identifying system-wide strategies that are associated with survival in these cardiac arrest patients in Australia and New Zealand. I'm also a research fellow with the Victorian State Trauma Registry. The Victorian State Trauma Registry is a world-leading registry because it not only captures the population-based incidence of major trauma in the state of Victoria, but we also follow up patients at 6, 12 and 24 months post-injury. What this enables us to do is understand the long-term burden of injury. My trauma research focuses on understanding the causes of injury, pre-hospital and in-hospital management, and the long-term outcomes of trauma patients. I'm also interested in understanding how these factors are changing over time, and this can inform both injury prevention strategies and also the clinical management of these patients with the aim of reducing the long-term burden of injury. In line with this, I'm also conducting a study reviewing trauma deaths in the state of Victoria. In this study, we are linking autopsy data with pre-hospital information from Ambulance Victoria and in-hospital information from the Victorian State Trauma Registry. In this study, we have two major objectives. Firstly, we aim to provide an epidemiological overview of the pathophysiological causes of death in these patients. And secondly, we are bringing together a team of trauma experts from both the pre-hospital and in-hospital clinical settings to conduct in-depth reviews of these cases. We're very fortunate in the Prehospital Emergency and Trauma Group to have well-established collaborations with both pre-hospital and in-hospital providers of critical care and also industry partners. We are driven by the fact that our research has the power to not only inform clinical practice, but reduce the burden and improve outcomes for patients with trauma or cardiac arrest.